Welcome back to my channel.
What are the complications of hypertension? Complications are damages to body organs, which when occur make the condition more difficult to deal with. They include stroke. This can occur in two ways. The first is that the increased thickness in the wall and narrowed lumen of the arteries supplying the brain cause marked reduction of blood flow to some parts of the brain. This leads to the death of brain tissue supplied by this obstructed artery. In the second crisis, the prolonged persistently elevated pressure within the arteries cause some parts of the arterial wall to weaken and balloon out, especially at branching points, to form aneurysms. An aneurysm in the brain can burst and cause bleeding into the brain, in addition to death of the part of the brain involved. Heart failure. This is a result of overworked and tired heart. It occurs due to marked weakness in the activities of the heart muscles, leading to inability to pump blood enough for the body's need. Heart attack. This is due to increased thickness in the wall and narrowed lumen of the arteries, supplying the heart muscles with blood. Thus, there is reduced blood delivery to the heart muscles, causing injury or death of those muscles. In this situation, the heart may be unable to continue its pump role and stop working. Kidney failure. This is the result of long-term deprivation of blood flow to the kidney. Blindness or visual impairment. This may be as a result of severe injury to the image-forming plate in the eyes called retina, bleeding into the eyes, or stroke involving the visual center in the brain. How does hypertension present? Hypertension is often referred to as the silent killer because it typically has no symptoms. Most people with hypertension appear to be healthy as long as the blood pressure has not caused any major organ injury. However, when symptoms do occur, the blood pressure is usually very high and are usually symptoms of complications or impending complications. They include headache. This could be a feature of an impending stroke, body weakness, which can affect one side of the body or the whole body. It is a result of stroke or an impending stroke. Dizziness. This could be a result of inadequate blood flow from impending heart failure or heart attack. It could also be a feature of an impending stroke, lightheadedness. Fatigue. This is usually a product of poor blood supply and oxygen delivery to the body organs. Blurring or double vision. This usually indicates the effect of the hypertension on the eyes. Shortness of breath. This depicts flooding of the lungs with fluid, a result of developing heart failure. Chest pain. This is usually from developing heart attack called myocardial ischemia. Leg swelling, which is commonly seen in the presence of heart failure. Sudden collapse or fainting. This could be a result of stroke or heart attack.